So here we are. Today is the final day of the American Heart Association Scientific Sessions 2007, and we're here with Dr. Ray Gibbons, a former president of the American Heart Association, and Dr. Tim Gardner, who's president-elect of the American Heart Association. I'd like to ask each of you from this year's scientific session, for you as clinicians, what are you taking home? What was most important? What is your highlight from the meeting? Share it with us, if you will.
As always, I think the things that come to mind are from the late-breaking trials. We saw two very carefully done cost-effectiveness analyses on COURAGE and OAK, two trials that have caught a lot of attention in the last year, showing that factoring in everything, that the advantages of PCI in patients in those trials were minimal and were not cost-effective. We also saw that there's hope with respect to newer, more potent antiplatelet agents in the management of acute coronary syndromes. The Triton study presented here and published in the New England Journal suggests that we may gain more potent agents at a cost of increased bleeding. And today, we have the largest beta blocker trial for perioperative therapy, which I think will raise more questions than it answers, but we will certainly be watching closely with respect to all the details to determine how that will impact on clinical practice.
Yes, and we also heard a failure of a very promising anti-lipid drug, a drug that actually worked with a lipid-lowering drug to raise the HDL and torcetrapib, and it is not useful and not safe because it has some sort of an off-target pharmacological effect that was not anticipated. So that was a disappointment, because I think that drug could have played a big role, or that type of drug, a big role in a difficult group of patients who still have lipid-related risks despite lowering of the LDL. But I think it was also a bit of a wake-up call that you can have a drug so far along in the drug development cycle that you can see this unexpected problem.
So let's talk a little bit now about prevention.
Blood pressure remains a huge problem. We've known for years we should treat blood pressure. We don't do it very well. How do you treat it better? So reported at the meeting, a Canadian study showing that a stepwise, here it is, 1, 2, 3, 4, do it this way approach worked. It led to better blood pressure control. I think that's the kind of thing that we're looking at. At the same time, we're recognizing that risk factors looming on the horizon that are growing in prevalence, obesity and diabetes, are threats to the past progress. So there's an array of studies.
Exactly.
Dr. Gardner?
Yes, and I think Ray makes an important point that we are seeing renewed interest or new interest in some of these risk factors. I mean, obesity, metabolic syndrome, and so on, were not really necessarily part of our basic science investigative arena. And we're seeing much more interest even at that level, because it is such a looming problem and such a big problem on the clinical and population.
Oh, let's talk for a minute about obesity, which I'm fairly sure you be aware that last week from another area of medicine, oncology, from cancer research, there was a paper reported, a study reported, a meta-analysis of the effect of obesity on driving certain cancers. So I just wanted to ask you to hypothesize with this word, with the cancer community there, this latest paper sort of getting on board the obesity bandwagon, if you will. Do you think that that you will be more successful in the future in attacking obesity in the way that smoking, the incidence of smoking, has gone down in the United States? I mean, could we liken it to the campaign against smoking as well?
We're going to have to be. Now, the AHA joined with the American Diabetes Association, the American Cancer Society, in joint sort of prevention statements within the last few years. There's going to be a conference jointly between the three groups talking about prevention coming in the spring. As a healthcare system, we have to focus more on prevention. Right now, the obesity portion of the AHA's 2010 goals will probably not be achieved. And that goal was very modest, simply to slow the rate of growth in obesity to zero. Not to reverse it, to slow the growth to zero, where it's not going to be zero.
Ray's presidential address last year focused on the challenges that we face in this society, in the U.S., with our healthcare system sort of organized the way it is, where prevention is not something that is reimbursed or supported in any major organized way. It's very hard for a prevention doctor to almost make a living.
Yeah.